Does it look like it's live? Good morning, everybody. My name's John Sanders. I want to welcome you to First at Blue Ridge and express gratitude and appreciation for you guys coming out here and joining us today and getting your continuing education with us. We really enjoy putting on these workshops. As Linda said earlier, we are live streaming to YouTube. There's not really anybody watching, but because I didn't really put it out there, but this is kind of a test that we're doing today. But we do hope to add live streaming as a product that you can watch a live stream and interact in real time with us asking questions that you can do from home or your office. So that's our goal. So today is just a test day, but we are actually live streaming, but there's nobody watching. But once we get it all ironed out, we hope to do this every time. And that's what the handout I gave y'all was about, that it's saying that your voice or your image might be recorded. We're not trying to record your image unless you walk in front of the camera or something. Your voice, we'd love to record if you have questions and that kind of thing, because it makes the training experience more rich for the viewers online. But the part, like, we may take these videos and put them on online courses and everything. So what I'm saying is, if we put it on an online course and we're charging $35 and you walk in front of the camera and your image is on it, that you're giving up your right for compensation in that case. You know, sometimes people walk right in front of the camera right when Linda's saying something important or whatever. So walking in front of the camera is not going to earn you. Yeah, we're not making much money to begin with. We can't pay everybody else. So anyway, I just want to explain that handout. That's what that means. But we would like to get y'all's input and questions, and if you're willing to use this microphone, that'd be great. We're not going to put you on camera, but we'll record the voice. And if you don't want the camera, you can just wave it away, or, you know. So Linda told you about the bathrooms. We've got coffee, water, tea, and that's it. Does anybody have any questions about the technology before we introduce Linda, who's already been introduced, but she may introduce herself again for the live audience. The live audience of one, which is probably me back there.
Or two. Phil.
I just need a handout.
Okay, she's making copies and should bring them into us. I'll go check on that.
All right. Well, welcome everybody again, and I'm Linda Harrison. You'll have to hear that again. I work at Mission Hospital part-time and have a part-time private practice as well. I work a lot in addiction and trauma work, and thus my interest in the topic today, trauma-informed care. And I'll just launch from there to say that our topic today is advanced trauma-informed care skills. And what makes it advanced? Typically, trauma-informed care is just learning about the neuroscience of trauma. It's about understanding how trauma is stored not only in the brain, but the body as well, what we call somatic storage in the body. And trauma can be anything. We'll talk more about the definition of trauma, but I want us to limit our understanding of trauma to someone who's been diagnosed with PTSD. Many people will have trauma or negative events that have happened in their life stored in their brain and body and never be diagnosed. So to think about, oh, I can't apply these skills to anybody unless they're diagnosed with PTSD is absolutely absurd. So I just want to say that, well, that was a powerful word early this morning, absurd, is that the skills that you will learn today, as well as the neuroscience, is applicable to every single human being. If they're breathing and their heart's beating, they have negative events, trauma, and chronic stress stored in their brain and body as a way to survive that. And one thing we also know that we'll find out today is that not only are negative events, chronic stress, and trauma stored in the brain and the body, but all the good memories and good events and loving moments are stored there as well. So it's not as if today we're going to go, oh gosh, we're all broken. We're all perfectly flawed to be able to become the most loving, creative human beings ever. So just to realize that your system is an elegant design for healing and homeostasis. So I don't want us to leave today on a negative note. After taking the ACEs exam, we're not going to do that today, but we can talk about some of the questions on it. One of the first things that clients, after they have that test, how many of y'all have heard of adverse childhood experiences? Raise your hand. Well over, well, 3/4, if not everybody. You know that test. How many of y'all have taken that test? How many of y'all felt pretty sad or negative or broken after that test? Yes. And can you imagine how clients feel? So after taking that test, we also then want to look at administering a resource test. How did you survive it? And many of those are online. If you can't find them, I will share with you my personal one that I created, so that it's a series of questions that helps them look at how they survived those adverse childhood experiences, because how they survived it is then how you can strengthen them and remind them of the positive things that happened in their life to get them where they are today, that they are a survivor, and that these things can also help them thrive. So I'll start off with that. Advanced trauma-informed care is learning actual skills to help the client or patient. Regular trauma-informed care is helping you understand the neuroscience. So we've taken that a step further. All right, any questions before I start? All right. Hear the spring birds outside in January? Anybody hear any frogs yet or spring peepers? I'm hearing them on my farm. It's crazy. All right, so our objectives today, define trauma from a body-centered concept, its impact, and the goals of trauma-informed care. John, do I need to turn off this light up here? Can you see it okay? Good. The second is we're going to describe the ACEs study, or Adverse Childhood Experiences study, and define resiliency. And that resiliency, again, is what we're measuring when we give a questionnaire after the ACEs questionnaire, that how did you survive it? Then we're going to describe post-traumatic growth. There is hope after trauma and trauma management and treatment. And we're going to demonstrate and learn 8 to 10 emotional regulation skills for you to use so that you can feel how they work, and to teach and utilize with clients. Has anybody used some of the trauma-informed skills, like the pretzel and that kind of thing with clients? Look, again, 3/4 of you. So you guys are doing it. You guys are out there. And does it work? Who wants to share a little bit that one skill you've shared and their response?
I had a client that I did the pretzel with, and she had never experienced it before, and she started crying after, and she said, "I wish I had known this sooner." It really helped.
So I wish I'd known this sooner. I wish I could have, yes. And that's often a response. Those tears aren't tears because they're sad. They're tears of hope. Gloria?
I had a veteran, a male veteran, in my office to spend some time with him, and he talked about, being in combat and his PTSD and stuff like that, and how he would get so highly anxious that he couldn't control himself. Mm-hmm. So I taught him the pretzel and the butterfly. I haven't had a problem with him since.
Yeah, very helpful for him.
And
then.
he thought he had to have some sort of very addictive medication. I said, no, you do this and see how this works for you. He did.
Good. So yes, the skills that we'll be learning today are designed to work with the brain and body to be able to calm the nervous system, which then cascades into all other systems of the body, such as slowing and calming and deepening breathing. It relaxes the musculature of the body. So we know that with the emotional regulation skills that you'll learn today, that there is a parasympathetic response, and we'll learn more about that response. Thanks for sharing that, guys. A trauma treatment model, the one we're going to use today, comes in 3 phases that support a person not only to survive but thrive. Now, your PowerPoint may be a little different than mine. I rearranged some slides last night and added some questions because of the online that we're recording today, so don't panic. Take a deep breath, pretzel up, go with the flow, all right? So number one, the first phase we're going to look at today is safety and stabilization. In other words, we've got to create safety and calm for that client. And if we say calm down, how does that work? Not so good, because who said calm down when we were growing up? Our parents or a caregiver. So we want to create safety by these emotional regulation skills. We want to stabilize their emotional body and their physical body. We want to build trust through healthy relationship and emotional regulation. So how many of y'all been reading about and learning about attachment, healthy and unhealthy attachment growing up, and how lack of healthy attachment can lead to lack of trust and trauma and various response patterns where people don't have healthy connections and aren't able to create those. So this first step is really a healing step that builds that trust, creates that stabilization, and gives them hope that they can build healthy relationships and trust again. If we go too fast and we don't build trust, how does that work out? Not so good. So the second phase will be processing of traumatic material using cognitive behavioral therapy and other CBTs such as acceptance commitment therapy or DBT, dialectical behavioral therapy. DBT covers emotional regulation, distress tolerance, interpersonal skills, and mindfulness. Now, we're not going to learn these techniques today. We're just talking about how to refer clients to these basic trauma treatment modalities. We begin with CBT, again, just like the emotional regulation, so that they can begin to stabilize and build healthy relationships. Then, really, the next step would be to refer them to EMDR, natural flow EMDR, brain spotting, trauma resiliency model, sensory psychomotor, somatic experience, or another type of somatic therapy. So we want to get them information and get them stable before we refer or begin the work of deep somatic trauma treatment. Then the third phase we're going to talk about today is how to reconnect them to the community, how to reintegrate them into the community so that they can grow post-traumatically. So those are the three phases: safety and stabilization, processing of that material leading to referral to somatic trauma treatment, and third, how to help them reconnect and reintegrate into the community. Makes sense, doesn't it? That's what builds healthy attachment with self, with family, and community. So let's talk a moment about what is trauma. And anytime I use the word trauma, I want you to also add the words trauma, chronic stress, and adverse childhood experiences. So it's typically defined as an actual or threatened death, being confronted with actual or threatened death. You'll hear many clients say, I thought I was going to die. Our car flipped over several times, and even as drunk as I was, the first thought I had is, we're going to die. And I looked over, and I was so afraid I was going to see the driver, and he's died or is bloody or something horrible happened. But he was okay, and we were able to unbuckle and get out. So that's still trauma because he experienced what he thought he was going to die and the person with him. Serious injury, so physical serious injury, threat to the physical integrity of yourself or somebody else close to you at any age, at any age. A person can have experienced a traumatic event and never be diagnosed with PTSD, correct? Now, I'm just going to toss in a couple other concepts that I don't have slides for, but because my brain is so full of information, sometimes it slips out. When we talk about at any age, many of you may have heard about pre-verbal trauma. That is trauma before a child is able to speak about it or formulate to understand what the trauma is and ask for help. So there's pre-verbal trauma. That pre-verbal trauma can also be intrauterine, when the baby's still growing inside of the mother's uterus. There could be a chemical assault from addiction. There could be assault by the mother's experiencing domestic violence and she's got high cortisol levels. So we have intrauterine and pre-verbal trauma. And what we're really referring to here is verbal trauma. And that's why I wanted to go back a little bit and say that there exists pre-verbal and intrauterine. And all of that trauma or chronic stress can be treated and managed. So immediate responses to a traumatic event include intense fear, helplessness, horror, detachment, and the physiological responses we know of: fight, flight, and freeze. And the thing about fight, flight, and freeze, because we know trauma is stored somatically in the body, those responses of fight, flight, and freeze can come up at any time long after the traumatic event is over. Now, how many of y'all have worked with a client or a patient who says, "This is stupid, I'm not staying in SAIOP," or "I'm not staying in treatment, nobody gets me, nobody understands me, I'm out of here"? Is that fight, flight, or freeze, or a combination? It's a combination of fight and flight. Their trauma's been triggered by whatever, they don't understand what that is. And a rational person with not a lot of trauma and some resiliency might say, "I feel like when I attend group, everybody's problems are worse than mine. Help me understand how I can be in this group when I just smoke weed and everybody else in there is using IV drugs or is a gutter drunk." Do you kind of hear that? At least they're able to talk, they have resiliency enough to override their fight, flight, or freeze response, to use their words and begin to work through it. That's a resilient person. But many of our clients, straight off the street or having had lots of trauma, cannot formulate those words. They simply react from fight, flight, and freeze of an event that happened a long time ago. Make sense? Good. I said everybody's just like smiling and nodding their head. I'm preaching to the choir here, I can tell, because you guys are really trained. Yeah. Were you gonna let me, are you okay with this? Good.
One thing, I've been reading a book I've already read it, by Pete Walker, Complex PTSD from Surviving to Thriving, and he talks about fawning, fight, flight, freeze, and fawn, being kind of, to me, where the codependent behaviors kind of take hold. And because if you can't fight, if freezing doesn't work necessarily, and you can't run, fawning, like really trying to, like, well, what can I do to help you?
Yeah,
and
giving in.
Giving in, and I had never thought about fawning as one of those, so now I add it.
Yeah, and I think about, I've read him, I think about fawning too showing up like fight, flight, and freeze long after the event, where they're just trying to survive in a domestic violent relationship, or it's a child trying to mitigate dad who comes home, and until dad has his first drink, dad's angry and throwing things and screaming at mom. That child will go hide or will say, "Daddy, can I fix you a drink?" The child becomes parentified and learns to fix dad's favorite drink to mitigate dad's anger. Or a partner who has a mate who's violent, they begin to say, "Oh, honey, I'm sorry." He says, "I wouldn't have had to slap you if you hadn't have burnt dinner, or if you hadn't have cooked chili beans one more time." And she'll say, "Oh, I'm so sorry. I won't cook it, but once a month, is that okay? Or I'll do anything, honey. It's okay. I know you're tired. You've worked hard all day." That's fawning. Yeah, really giving in, really mediating and placating to try to keep the peace. All right, thanks for sharing that. So impact of trauma, long-term, again, responses. So we looked at short-term. Long-term responses to a traumatic event may include ongoing reactivation of those survival responses. And when triggered, they experience, again, fight, flight, and freeze. A good example at mission of flight would be a patient who wants to go AMA, against medical advice. A good example of fight and resistance: "I'm not taking my medications, and you can't make me." So fight and flight shows up many different ways in many different settings. And the freeze response, a classic that really stands out to me, is I was going in to do an assessment in the emergency room, and there was a gentleman there who, it was Thanksgiving, it was a holiday. His mom had kicked him out and locked the door. He's a young veteran. And as he said, when I got back from Iraq, I just crawled in a liquor bottle and I didn't come back out. And when I went in to do the assessment, he wouldn't roll over and talk to me. He kept his back to me, the covers pulled over his head. And I just sat there and talked with him a few moments and really built rapport and a healthy attachment. But he was in a freeze. He didn't have any hope. He was ashamed. He felt like he was hopeless. He didn't know how to respond other than to remain in that freeze. But people will thaw out if we spend time with them, support them. I hear you, I'm here for you. You don't have to do this journey alone. If you've got some clean time, let's build on those strengths. And the next thing I know, he rolled over, pulled the covers off his head, and he sat up on the side of the bed, and I was able to continue with that. So he actually went to a recovery program, an inpatient residential after that, was clean for quite a while before I lost contact with him. Other long-term responses is shutting down of essential tasks such as digestion. We're going to talk about, and the ACEs study really talks about, how trauma and its response in the body affects health over a lifetime. And this is a classic example. If I keep re-experiencing trauma in my body from long ago, and that keeps happening to my digestion, like every time I eat, I get indigestion because my body's so activated from the trauma that happened a long time ago. What's my digestion going to be like? Not so good. And some of the physical problems that we have with digestion are what? Irritable bowel syndrome, IBS, ongoing indigestion, Crohn's, colitis. So we see many digestive problems that may be, and diseases coming from a person whose trauma is not treated. And yet they get lots of medications to help with the symptoms, but the root cause, the trauma, is not treated. So if the root cause is treated, that person may be able to get a shift in their digestive issues.
I was just wondering if it could slow metabolism down? If it could do something to metabolism?
I don't have a direct answer to that, but I know that since trauma affects all systems of the body, I would imagine it would do that. I think the research that you might be referring to or you might look up has to do with cortisol, high cortisol levels causing a person's metabolism to slow down. Check on that. I've read so much that it's like, wow. And neuroscience is blasting off. The research is so fast and rapid right now around trauma and the physical body and emotional body. So rational, we know that it can lead to diabetes. We know it can lead to high blood pressure and many other things. So I hope we'll have time to watch the ACEs. Nadine Burke-Harris, who presents on ACEs on a TED Talk, we'll watch some of that. If not, you'll have it in your PowerPoint. You can watch that on your own time. It's 15 minutes. I highly recommend showing it in SAIOP and other groups, treatment groups, because watching that video, you'll see people go, oh, I get it. The trauma I had growing up has possibly led to my high blood pressure, my diabetes, and my addiction to whatever their drug is. Gluten intolerance. I don't know any research directly, but again, if it affects our body that keeps us from having appropriate digestion, it possibly could lead to that. If you Google it, gluten intolerance and trauma response, I bet somebody's done a research. And if not, there you go. Somebody can. Rational, so another long-term impact is rational or linear thought is less possible at this time as the limbic or emotional brain becomes very active to help the person survive the event. So remembering, if you have a child that can't pay attention in a classroom, it may be because he's functioning from his limbic brain and his thought, prefrontal cortex and cortex is offline. So Bessel van der Kolk, for those of you that work with children, I'm going to throw you guys a few references today. Bessel van der Kolk, a trauma expert for sure, talks about how trauma affects children differently than adults. And he talks about 3 areas where it shows up. inability to pay attention, inability, easily distracted because they're living from that limbic brain. He also says poor attachment, inability to develop relationship and trust because of trauma. Because developmentally, if the person that's supposed to love you, rock you, and read you books is hitting you and staying drunk and not creating structure and not getting meals to you on time, how much trauma do you have growing up, and how much does it interrupt your development? So inability, often inattentiveness, inability to pay attention or attend to task, and lack of healthy relationships or bonding, developing trust. And the third is emotional regulation, that they struggle to regulate their emotions. Head Smart, Trauma Smart. Look that up if you work with children or are interested in this topic. Head Start Trauma Smart is they're giving children words to describe what's happening inside. I'm having a big emotion right now. I am so mad. And they might say, then let's do some deep breathing, like Elmo's belly breathing. If y'all aren't familiar with Elmo's belly breathing, that's on Sesame Street Community. You can Google that as well. It's a video of Elmo and his friends teaching a breathing technique called belly breathing. So they use that in Head Start, Trauma Smart, and many other preschool or school activities. So with children, we learn Head Smart, Trauma Smart, and Bessel van der Kolk and other leaders in the field created a diagnosis that was not accepted into the DSM-6. Is it 5 or 6 now? 6? 5, thank you. There you go, that's about how my brain works. It's called childhood developmental disorder. It was to replace oppositional defiant and all the childhood disorders like ADHD, which are a result of trauma, because children are often labeled and punished or not treated for the root cause, which is trauma. But maybe the next time around that will happen. So I want to show you just one short video clip. I have both of these pulled up, but I'm thinking I would like to, they're all so good. So I'd say the first one, I'll just go ahead and show you about the 3-minute one, which is a trailer to a movie that is a movie documentary that's called Thank You for Your Service. It's about veterans from Afghanistan, Iraq, who have severe trauma from being in active duty. And many of these veterans may have had previous trauma. If they had childhood trauma, or were in domestic violence, or any trauma at all, or adverse child experiences, and then they go off to war, we're really looking at layered and complex trauma. So we'll watch that. The other one I want to just refer you to, and it's pretty easy to pull up, it's not in your PowerPoint because I think I added it last night, is right here in Asheville at the at the VA Center here. Okay, it's the Charles what? Charles George VA Center, thank you. Whenever there's 2 first names, I sometimes lose it. There was a physician there, I wish I could give him credit, but he gathered up veterans and began a narrative therapy group, a group where they could tell their stories and have a container for that. And it was so powerful that some of them wrote their stories, some of them just told their stories, but it moved towards kind of a narrative therapy kind of presentation. And then the Citizen Times got involved in other people, and they videoed several veterans telling their story. And it is beyond powerful. It really, for counselors and social workers, it gets you in the heart and mind of a veteran and what they've suffered from. Because if we've not been there, we don't know, right? But once you hear them, it begins to open your heart to what they've endured. And then this one we'll see in a moment, really captures Thank You for Your Service, which covers a lot of material, but being careful to, as a therapist, I encourage you not to thank a veteran for their service. Because what we're hearing, it may be very appropriate for one veteran, and he may be or she may be appreciative. For another, it's like you thanking them for doing what they did, which may have caused their trauma. killing people, seeing children and horrific war scenes that are now stuck in their mind and their heart, what we call moral trauma, as well as other types of trauma. So just to be able to say to them that I'm here for you and I'm all ears and I want to listen and understand what you've been through so that I can best help you are the most powerful words that a veteran can heal. How many, we got any veterans in here that want to share, or just raise your hand that you're a veteran and you've experienced that? So no veterans today. That's amazing. So basically, again, this clip just covers that. So let's watch just a short bit of that. For some reason, she's not picking up. Oh, have to put power to the speakers. That would help.
Speak of the unseen wounds of war.
I had lost everything that I'd ever had. My marriage had disintegrated. I'd lost my children. I didn't really know who I was. I pointed the gun to my chest, and I pulled the trigger.
There's not a single veteran that I know who doesn't know somebody who's committed suicide. We don't even know what's going to hit us in the next 10 years as a result of the past dozen years of war.
Man.
You couldn't have drawn up a more catastrophic way to fail to meet mental health needs than the blueprints that were following this war and that were following the previous war.
We were not allowed to speak of the unseen wounds of war. We were not allowed to prepare for them.
Nobody ever told us about PTSD or what to expect.
I was the only credentialed mental health provider, 6,000 Marines. As a Marine, I felt that was an absolute betrayal. We were leaving people behind.
You can practically see the demons just raging around inside. What happened? Just fractured in a really fundamental way. And it's like, I gotta do this, even if it's gonna hurt.
He wanted to know more about it, but he wouldn't let me in. He just wanted to escape.
But I've been afraid for what I have to go through.
The thing is that something's got to hit.
It would make me upset when people would come up to me and say, "Oh, thank you for your service, welcome home." What do you know about living with these memories?
We have to stop referring to veterans as sick. They are holding something for us. How do we approach it in a non-medical, social, political way? Better than what you hear. How many lives can we really affect? How many people's lives we can improve?
This is terrifying.
You can talk to if you're ready.
Let's hear it for our military. We'd like to thank you.
What jumped out at you there? So if any of you want to watch the Asheville one, it's called Brothers Like These. Asheville's VA has veterans fight PTSD with pros. Citizen Times article.
I wonder about people like my father who's...
Would you be willing to?
Yeah, I just wonder, how do we look at these people
as compared with past veterans who experienced all kinds of warfare, and like my father, who was a POW, and came back and never, he talked a little bit about it, but didn't talk, he said the same stories over and over.
Right.
And would talk a little bit more with my uncles who were there with him. And I found out years later that the reason I keep 6 months of food in the house is because I'm the child of a POW who never wanted to be hungry again. So for me, that's just normal to have loads of food.
Yeah.
And I didn't even realize where that came from.
Yeah, and you do now.
Yeah.
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 So the realization is that trauma responses last a lifetime unless treated, and that's what she just described. So how do we handle that? We simply listen. We're open to supporting and knowing that some veterans will take their trauma to the grave with them because that's their choice. And to respect that is really important. So you may have someone in that you're treating for addiction. If they're not ready to go to that trauma, we don't need to push or shove or thank them for their service. We just need to acknowledge that and tell them that we're supportive of listening to them and that there is treatment available for that. And it doesn't have to be painful. And they don't have to tell their story unless they want to. Trauma can be treated by simply using catchphrases that the body knows that's what's being worked on. So yeah, it's really, it's sometimes difficult to be aware that this veteran trauma is on a continuum, from little t trauma to very complex and layered trauma, where that veteran may have had trauma growing up, trauma at war, to only trauma at war. I don't mean to say just only, but just singly that, to veterans who in Vietnam who went overseas and fought and felt like they were doing what their country wanted or needed, and they came back and were spit upon. I worked with a veteran who was hit in the head at the, I believe it was the Charlotte airport, by a brick when he came home from Vietnam. There were people standing there throwing things at them, and he got a TBI upon arriving home in North Carolina. Yes?
I also had a Vietnam vet friend who was in the Gulf of Tonkin in the morning and in the afternoon in San Francisco in a topless bar. And so the dichotomy between the experience here and the experience there was very traumatic for him. And whereas in wars past, people came back on board ship and had a 3 or 4 week trip to process together. Whereas he came back alone and just was struck by the change.
Right. So that's transition trauma. Yeah, moving from an atmosphere or place or event where there's war to being safe and being inundated with lots of food and people and fireworks. And you won't see very many veterans at fireworks. The fireworks blast, the sound is is a lot like gunfire, so it re-triggers them. So yeah, there's no one format for treating trauma except showing up, listening, and supporting, and then teaching them basic emotional regulation skills, which we'll be learning today, so they can get some traction with regulating their emotions and their nervous system, and then referring them on to treatment for the trauma, EMDR or another technique, and or referring them to support groups for veterans. Because one thing about veterans, they really want to work with and talk with other veterans. We have, I'm not sure it's still viable, I haven't checked lately, but Helios Warriors, which was a program here in Asheville where therapists, psychotherapists, counselors, social workers, massage therapists, acupuncturists could go and donate their time, and soldiers could come there to get alternative or therapies that they weren't maybe able to get at the VA. There's the Veterans Healing Farm down in Hendersonville, which is a residential program, not only for veterans, but for families as well. And it's 10 acres. The man who owns it is a veteran himself, and they do classes there, beekeeping, farming. They raise vegetables and fruits, and once a week they take that in the summer to the Veterans Hospital here, and they literally give away tons and tons of food to veterans because they feel like it's so important for veterans to have appropriate nutrition and to share information about their program there and that there's hope and help. What's one phrase that jumped out at you in that video? What really got you? Anybody willing to share? I know the one phrase for me, but I'll let you guys go first.
What jumped out at me is I think we're focusing on the tragedy of what happens when people go into those situations, but often we don't focus on the policies in our own country that are sending those men and women off to do these things.
Yeah, and creating that moral injury.
Exactly.
Yeah, that it's a moral, it's a moral, what's the word I want? Issue.
Sort of along those lines that that in a way they're holding some of this for all of us.
Yes, that was my powerful phrase. We've got to stop thinking of veterans as sick. They're holding something for all of us. They went to war with the belief that they were helping their country, and they come home and they feel like they're not getting the care they need, or people don't understand that they're still having a reaction in their body as if they were there. There's a real interesting few videos called the go-go syndrome, where when they're at war or getting ready to attack or something's happening, they are trained to have a surge of energy, and they call it go, go, go energy. And when they come back over here, they don't know how to turn that off. So they're trained to go, go, go in an emergency or to battle. And as a guy said, I was sitting in a dentist chair when my go-go energy happened, and I ripped everything off of me and was in the corner before I realized what had happened. And I guess the needle or some kind of invasive procedure triggered that, and he went into go, go, go and was out of the chair. And of course, everybody I'm sure in that dental office had no idea what was going on. They might have thought he was crazy or something's wrong with him or he's on drugs or, something negative. And he simply was responding to an internal response that triggered the go, go, go. All right, I hope you guys will look at the Citizen Times story. The veterans are presenting in February what you'll see on that those video clips at the, Flat Rock Playhouse in Hendersonville. So they'll be down there, and I believe it is a fundraiser. Don't quote me on that, but I think it's a fundraiser for veterans. So I'm hoping to get tickets and go. So PTSD defined, and we're going to take a break in 30 minutes. So if for some of you that sit a lot, if you need to stand up and get in the back, please do so. And remembering again, if you need to use the restroom, scoot out that way. So the following responses to trauma and traumatic events are components of PTSD. And of course, people have this without being diagnosed. Hyperarousal, nervousness, jumpiness, quickness to startle. If you come up around somebody the side of them and you tap them on the shoulder and they don't know you're coming, what do? They have a hypervigilant, hyperarousal response. Re-experiencing of intrusive memories, sensations, dreams, and memories. We see night terrors in those with trauma. So that hyperarousal, hypervigilance, re-experiencing intrusive memories, sensations, dreams, and memories. Avoidance and withdrawal. This is where they pull away, feeling numb or shut down or separated from normal life. Pulling away from relationships or activities. Avoiding things that trigger memories or traumas or their physical body. So PTSD defined, looking for these symptoms. How'd you like to live your life like that? Some of you may have. Some of you snail may be living your life like that. So I want to speak a little bit about the vagus nerve. We're not going to go too deep on this, but Dr. Stephen Porges, who created or theorized the vagal nerve theory. The vagus nerve is the 10th cranial nerve that comes out of the head, the brain, down into the spinal column. The ventral vagal nerve, well, let me first say the vagus nerve splits in half. One half comes down through the front, that's the ventral vagal nerve. The other half goes down the back side of the body. That's the dorsal vagal nerve. And the vagus nerve, both ventral and dorsal, are designed to help us survive and to bring calm and balance back after we have become safe again. When you rub your belly after a really good meal, that's that ventral vagal nerve. You give somebody a hug, it activates that ventral vagal nerve. It's associated with trust and communication, and you know, those are my people, you know, those are my peeps there. You walk into a room of people, you walk into an AA or home group meeting and you go, these are my people. If you go into a church that you're comfortable and you worship there and have friends there, these are my people. You get that vagus nerve response. Our bodies constantly seek homeostasis or balance. Remember, we have an elegant design that will heal if we get the support we need. So homeostasis, and given the chance through emotional regulation, these skills that you're going to learn today, our nervous system will regulate itself and bring balance to all systems of the body. That's like thinking that physical exercise only makes big muscles. What does it do for your heart rate? Does your heart rate go up or down once you have a nice stable heart rate? Actually a low heart rate, which is good. It means it's not wearing your body out. What's your breathing like after you exercise and you relax? Is your breathing fast or slow or stable? It's slow and stable and full and deep. So we know that regulation skills, hatha yoga, those postures, meditation, mindfulness work, and working out, running can be helpful. Regulates both the muscular system, nervous system, cardiovascular, and all systems. Here's a way to remember this. And another way to remember it too, what does it do to our thoughts after we exercise? What are our thoughts like? Clear, optimistic, hopeful. So one thing to remember is what is biological is psychological. What we do with our body affects our brain and our thinking. What is psychological is biological. What we think, then our body responds to. If I simply sit here and I go back to a memory from the holidays when I'm with family and we're all sitting around and talking and laughing and telling stories, what is my breathing going to do? I'm going to be taking deep breaths and really enjoying and relishing in those memories. It affects me physically. So I use my psychological, my memories, to calm and relax my body. Now I can go out here and do hatha yoga and then sit quietly, and what I did physically with my body will bring calm to my mind. So remember that. What's biological is psychological, and what's psychological is biological. They're not separate, and we can work with one and it'll affect the other. Stored trauma, intergeneration, generational, as well as adverse childhood experiences and chronic stress keep the body and brain dysregulated and in a state of fight, flight, or freeze, or fawning, to pick up on your statement there. So think about this. The angry, resistant client is responding out of past trauma versus the open, receptive, curious, cooperative client that's engaged. Notice the difference. And this is, I don't remember what this is a link. Oh, this is a link to Dr. Porges talking about the vagus theory. He's at Chapel Hill now. He's in med school down at Chapel Hill. So you can actually look at some of his schedule online and go hear him speak at a coffee shop. He's that accessible. So he's a pretty amazing guy. He has a great story of getting an MRI. And he didn't realize he had trauma. You know, he's a physician. He's going in for an MRI, think he has some kind of health issue. And he said they started to move the tube inside to do his MRI. And he said, wait, I need some water, something like that. And they gets him some water, and then he starts to put the tube, and he goes, wait, I got to use the bathroom. So what happened is he realized he was having a somatic response, a trauma response, that he was not going in that tube. And he tells that story of how he actually experienced his own theory when he went in to have an MRI. He's a great guy. I really enjoy. So question number one, a traumatic event is one in which A, a person experiences actual or threatened death, B, serious injury to themselves, or C, someone else seriously injured, C, a threat to their own body or someone close to them at any age or time in their life, or D, all of the above? All together? D, yes. All right. So we're going to learn our first skill. Many of you already know this, but it doesn't hurt to practice it because we all need our nervous system reset. So this pretzel or hookup comes from educational kinesiology, brain gym. And last night I was looking up the research to put on this slide, and guess what? There's plenty of research and there's plenty of people poo-pooing the research. So I just got so agitated in my trauma response of Western medicine that I said, I'm not going to even deal with this because I, Linda Harrison, have been using the pretzel since when I was at ADAC, 97, and have taught it since 1997. And every person I teach it to talks about how helpful it is. And I go back to this one time after the holidays. I was exhausted. There was some kind of negative stuff at work or wherever. And I thought, I'm going to lay down, prop myself up a little bit, have a glass of water, and I'm going to do 4 extended exhales and pretzel up. I looked at my Fitbit. My pulse rate was 96. Obviously, I was pretty upset and didn't realize how upset. I pretzeled up and counted up to 120. Tapped my Fitbit, and it's the first time I've ever seen it get this low. In fact, I was a little concerned. It dropped from 96 in 2 minutes to 46. That's my research. So I don't even need to read it. I go back to, if this is helpful, do it. If it's not, kick it to the curb. That's my research. So how I sell it to clients and patients, I tell them that what I have noticed and read in the research is that if you do the pretzel for 2 minutes, minimum 2 minutes, that's the baseline, that it reduces anxiety, makes you more resilient. It will slow your breathing, slow your heart rate, which never hurt anybody, and it appears to stop panic attacks dead in its tracks. And I know that because I almost died from sepsis 4.5 years ago, and I came home with night terrors, because I had seizures while I had sepsis, and if you've ever had seizures, you can't breathe. And I was trying to tell, and I was in the emergency room, I was trying to tell my husband to get help because I was going to seizure and die. And he just kept saying, it's okay, honey. He didn't realize what was happening because he's a carpenter. He's not a physician or a nurse or a social worker. And I was able to finally get out, if they don't stop these, it will kill me. And boy, he took off. So not having breath is very traumatic because it's actual or threatened death when you're seizing, and you know what sepsis is. So I practiced when I got home. I woke up with night terrors, and I get into a pretzel and do the 4 extended exhales, and it stopped it. Had I not had that skill, I don't know where I'd be today because I could not have survived those night terrors. You know what would have happened? I'd have called a doctor, and what would I gotten a script for? Xanax, yes, which is highly, everybody say it together, addictive, yes. And so simply knowing the pretzel and using it stopped my panic attacks, reduced my anxiety, and allowed me to come here today to share this with you. So that's how I know it works. So I tell them, basically I tell clients it will reduce anxiety, to them, especially the more they practice, it reduces anxiety and will stop a panic attack. Try it if you like it. If you don't do it. All right, so I'll ask a client, and I'll sit down to teach this. I'll ask a client, are you right-handed or left-handed? And if they're right-handed, I'll say, great, cross your right ankle over your left. If they're left-handed, I'll say, great as well, cross your left ankle over your right. Them arms straight out in front of you, palms facing. Turn your thumbs down. If you're right-handed, it's right over left. If you're left-handed, it's left over right. Lace your fingers gently, drop your hands down, push out your elbows, and come up to your chest. Now, if that's too tight, you can loosen up a bit. If that's uncomfortable for some reason, you can also rest your hands down crossed on your lap. You can do this sitting in a chair, you can do this lying on a bed, but you cannot do this standing on your head. I just love, and what does that come from? Dr. Seuss. Who grew up with Dr. Seuss? All right, so now this next part's important. If you're comfortable, close your eyes. If not, gently look down and soften your gaze. Remembering that many of our clients will not be able to close their eyes because of their trauma, so we want to offer them both. If you're comfortable, close your eyes. If not, look down and soften your gaze. We're going to start with a nice deep breath in the nose and slowly blow out through pursed lips. And when you're ready, a second deep breath in the nose. Slowly blow out through pursed lips like you're blowing out a candle far away. And a third. And a fourth. And now breathing normally, you can either slowly count up to 120, which will be 120 seconds or 2 minutes, or you can go back and access a favorite memory from the holidays or something over the last few days, weeks, or months, and really put yourself in that memory, noticing who was there, what was happening, what made it so special. Really relish and get into that memory, or count slowly up to 120. I'm going to count to 120 slowly as well, and when I hit 120, I'll bring us all out. Remembering, if you become uncomfortable or need to relax your arms down or open your eyes, do whatever you need to do to take care of yourself. And with a nice deep breath, when you're ready, begin to relax your arms down and open your eyes. So I hope everybody at home did that as well, in case one person's watching. So what did you notice? What did you notice? What do you notice right now about your brain and body and how you are now as opposed to when you started the pretzel?
Feelings of peace.
Feelings of peace. Anybody else want to share? What do you notice? I noticed the light in the room is different. Did y'all notice that when you open your eyes? change in lighting, it's like, whoa, it's really bright.
A feeling of security and safety.
Yeah, safety and security. What else did you notice? What happened to your thoughts? Do you notice what your thoughts did? Your thoughts stopped? Your thoughts slowed? Yeah. So what happened is when we cross midline with our extremities, there's some thoughts about what happens with that. One is that when we cross midline, the midline of our body, we cross that right and left hemisphere midline, that the brain says, she's doing something different down there. What's she doing? And the brain has to kind of pay attention like, ooh, you know, it's noticing that I'm not doing this or talking or running around. I'm pulling in to my core and I'm creating a container and I'm crossing midline with my extremities instead of my extremities doing what they always do, which is moving around or doing stuff. So as we pull that together, crossing midline, they believe, sends a gentle impulse to right and left hemisphere. And what it feels like to me is like my brain is being rocked like a baby. It has this calming effect. The other thing that they are thinking is that, again, the container idea, that we're creating a container as well. And for people who have trauma, Peter Levine talks about they have a hole in their container. They're hemorrhaging energy. They're in fight or flight constantly. And so this creates a safe container of the physical body in which to take a few moments to just settle in, How many of y'all meditate? Anybody meditate? What have you noticed over a period of time about your meditation? If you're fairly practiced and regular, what happens? From when you first start, are you able to meditate deeply? No. It takes over a period of time to train the brain and body to settle. Now, I'll tell you, if you want to cheat when it comes to your meditation, you can reset your nervous system so that you can meditate more easily and deeply if you pretzel up first. And many people, before we meditate, we do things like alternate nostril breathing, which does what? Stimulates right and left hemisphere. We might do some 4-7-8 breathing. We might do some yoga postures. Even how we sit when we meditate, how we place our hands, how we cross our legs, or the way we sit creates a space and a container and calming, because it signals the brain and body it's time to drop in and meditate. So we know that through yogic tradition, which is a science and not a religion, just clear that up, through yogic tradition, and Ayurveda is a science, and they're definitely linked, is that we're working with the body to settle so that our consciousness can expand and calm. So again, what's biological is psychological, and what's psychological is biological. So on your handout that you have, and please use this liberally, it has no copyright. It's really interesting in the United States. First thing people do when they create something, they rush out to copyright it. It's about time we recognized where this material is coming from, and it's coming from the energy that's part of all that is, and it should be shared and not hoarded. So I'll say that about my moral issue around copyright. More, mine, me. It's about us and cooperation. So on your handout, it's got the pretzel, it's got some neuroscience explanation, it's got verbatim how to teach it. You can simply read it to the client. Because over the years, people have said, Linda, I need you to write down how you teach that. The key things, okay, so I do want to teach it to you real quick about children. Children, we, instead of saying breathe in through the nose, out through pursed lips, we say breathe in the nose, smell the rose, even having them pretend like you got a rose in your hand, smell the rose, blow out the candle, smell the rose. And when you can really smell that rose, you know you're good in meditation, and blow out the candle. I was in the emergency room with a little boy who was bouncing off the walls, had a severe diagnosis, all kinds of trauma. I think in utero, his mom had been an addict. He was on about 6 different meds, and he was bouncing off the walls, and I taught him the pretzel. And he sat down beside me, and the fact that he could just do the pretzel I thought was a miracle after bouncing around on the walls. He said to me, after the pretzel, he looked at me. He was sitting there like this, and I said, and when you're ready, you can relax your arms down. And he looked at me very peaceful, and he said, I feel like I'm in a dream. That will go in my autobiography. And when I left, he threw his arms around me and said those words we all long to hear, I love you. That's what he said before I left. We did the pretzel, and we also did butterfly tapping, so you'll learn butterfly tapping in a moment, which gave this child the experience of hope and connection and trust and healthy attachment. So this works with all ages, and when we get to tapping, you can even tap on an infant. It goes all the way down to infants. So understanding trauma from a body-centered concept, the use of psychoeducation and movement to stabilize a person. You want to look up Pat Ogden and look at her videos. Pat Ogden describes the effect of trauma on the body and how movement can be helpful. She actually has a board that she keeps in her office, a wooden board, has 2 holes in the ends and 2 ropes that come up with handles. And she has them seated. She'll have them put it on the floor, put it under their feet, hold onto the ropes and pull up and push down with their feet and feel how strong their legs are. Feel the strength in their legs. Because many people with trauma weren't able to escape. They were helpless or held down, especially sexual trauma. And so to use that board and pull up and feel the strength in your legs really lets them know with the phrase, feel how strong your legs are. Feel that your legs can carry you to safety, help you escape. And that's that sensory psychomotor, really getting in a body that's no longer being held down but is strong and can escape and run. Peter Levine has a great video about a client he was working with who was in a trauma response, and I forget what was happening to her, but he said he had a sense that a tiger was after her or an animal was after her. He said, run and get up on that rock. So she's running while she's sitting still, and Image is jumping up on the rock, and she's safe from whatever was after her. And that broke the trauma response, and he was aware again of how imagery and safety can break that trauma response. If you guys get on YouTube, it's candy. The very people who are doing this research and the therapy, we can listen to them and learn from them and understand their language that's been so powerful to help and work with clients and patients. But Pat Ogden. I think I've got Pat pulled up here. Let's see. If we do, hers is like 2 minutes long, and it's really, it's good to use. All these we can use with patients and clients, so feel free.
And you said Hope Connection, and what were the other 2 things?
God only knows. Once it comes out of my mouth, it's like trying to retrieve a fish I just turned loose in a pond. Somebody will remember around you. I have so much going on in my brain at all times. Do I seem manic today? I did do my yoga this morning. All right, so let's listen to Pat Ogden. For some of you that don't know, ICABM is somebody's going to know what that stands for. It's like the National Institute of something in trauma. NICABM, we'll probably see it, the acronym in a minute, has free trainings and trainings you can purchase. It has free research articles. And it's all about trauma. You'll meet Ruth. She created it. There it is, icabm.com. Apple didn't give me enough USB connections.
But sometimes, even just being aware of when trauma happens,
its impact is generally felt in the body first. That's why working with the body can be crucial for helping patients heal from a traumatic experience. But sometimes, even just being aware of
their bodies can make some trauma survivors feel re-traumatized. So how can we help them move beyond the fear or anxiety that the body often holds? According to Dr. Chad Ogden, there's one thing in particular that could give patients a new perspective.
It's highly individual depending on the client. Some clients are very afraid to even be aware of their body because as soon as they become aware, they feel re-traumatized. They feel all the fear, and they feel the arousal, they might start to shake, and they don't see a way through that. So sometimes psychoeducation can really help. That a normal response of the body is to tighten up and freeze and shake when there's trauma. And those responses are natural with trauma, and we can work with those through physical action, through re-engaging protective mechanisms in the body. Sometimes a little bit of psychoeducation goes a long way. Some clients are phobic of the term body, and even using that term sends their arousal out of the window. So we might talk in a different way. We might talk about experience or movement instead of body. Other clients need what we would call somatic resources, like one patient that I had, severe trauma, highly dissociative. When she sat down, she couldn't really focus. She was so frightened. And her legs were really tight, and she kept looking at the door. And so we simply got up and started walking around the office, and I asked her just to feel the power of her legs, like that her legs could take her away. Anytime she wanted, she could walk out that door. And to really feel that in her body, when she sat back down, she said, I feel really different. Because although she intellectually knew, of course, that she could walk out, she didn't have that somatic sense of her legs being able to flee. Because as a child, she was a prisoner of her abuser. She couldn't flee, she couldn't get away. So sometimes those kinds of resources can then open up the safety that's needed to work with the body. I tell people that you need to find out from your clients why they're so frightened of their body, and then find a way to, with psychoeducation or somatic resources or case examples, to help them feel hopeful.
When it comes to treating trauma, one key is understanding the source of
apprehensions so we can help them feel safe working with the body.
Oop. I was going to freeze that so that we could look at those two videos they were recommending at the bottom. Let's see.
Courses or case examples to
there
help
it is.
them manage clients' apprehensions so we can help them feel.
All right, so it looks like there's a couple more videos, and those look really good because this is Peter Levine. I was talking about how trauma gets stuck in the body and how to work with it with Peter Levine. He also, if you put in Peter Levine polar bear, he has a video of the polar bear running and it gets shot with the tranquilizer gun, and then you see the polar bear come out and the polar bear starts shaking. So we know that there's a mammalian, a response we see in mammals of shaking, to shake trauma off. As human beings, we've lost our ability to shake it off, but you can see with the polar bear. And many of you have probably seen if you have a cat at home, and that cat will catch a squirrel or a chipmunk or a mouse, and they'll bat it around and play with it to get its digestive juices going and all. And and then suddenly that little animal that the cat's batting around will just, act dead. What my granny would say, oh, it's playing possum. Well, it ain't playing possum. It's passed out. It's in a freeze response, because then the cat's not interested because it's not a squeaky toy anymore. The cat leaves, and then what happens? The animal kind of jumps up, shakes, and runs off to freedom. So that's what that video with Peter Levine with the polar bear is talking about, but many of y'all have had that experience in your life. And many of you may know about, I think it's trauma release TRE, trauma release exercises that they're using with veterans, where they have them begin shaking, just start moving their body, just start shaking. And usually on the floor, you'll see the videos of them laying on a gym floor, and then they enter into some of the memories that are intrusive or bothersome. And so because they're shaking, it either initiates that trauma release, because of the memory that comes up, or they can go to a memory and shake, and it will shake it off. So trauma release exercises, there's another actual treatment. And then here's a good one that says 3 strategies to help trauma patients feel safe. And that's Peter Levine, Pat Ogden. Does anybody recognize her? I don't know that face. But anyway, there's another video. All that looks like through NICABM. And man, free stuff is hard to come by, so check that out. All right, so it is time for a break, which you guys have deserved. You've been excellent. So we'll take a 10-minute break, come back at 20 till, and we need to start promptly at 20 till if you'll watch your clocks. See you then. And if you have questions, I'm here to answer questions at break. Anybody eat chia pudding? It's very good for you. It's very easy to make. It's just chia seeds, coconut, dried pineapple, a little bit of stevia, some vanilla, and milk. And then it, you know how it swells up. I had a client once that had some chia pudding. He said, "What's that?" And I said, "Chia pudding." He said, "Boy, don't you know that can get you stopped up and they got to do surgery to cut it out?" And I went, "That would be adding more water to your chia seeds." I thought it was funny. A person would read something online, change their whole life about chia because somebody ate chia seeds without following it with a liquid. Anyway, people are funny like that. I'm more the kind of the person like, I love, and chia seeds, they get everywhere. What is it with them? And in your teeth. So, welcome back. What's one thing you can take with you that you learned this morning? Who's willing to share? One thing you can take with you that you learned this morning.
Do the pretzels, save money. Do the pretzels, save money. You don't need big pharma.
There's Gloria, my favorite renegade. One thing you can take with you from this morning. One more person, we'll move on because we're like on slide 13 or 14 and there's 57. So I'm not sure we're going to get to the end. I love that on evaluation. I wish you'd have finished the PowerPoint. Really? Do you really wish I'd have given you PowerPoint, death by PowerPoint? All right. So since y'all are going to be shy, we'll just move forward. So reminding you, stage 1 of trauma-informed care is stabilization and building of trust with that client. So important. So stabilization, especially in an acute care setting such as a hospital or a trauma unit or emergency room, stabilization in your office would look like teaching the pretzel and some of the other emotional regulation skills to help them begin to stabilize with you in the room so that you can do the assessment or move forward. Many of you may have been doing an assessment and a person gets triggered and you've noticed that. And sometimes you've had to do 5, 4, 3, 2, 1, like tell me 5 things you see. You have to stop and get them stable so you can move forward with the assessment. During the stage 1, basic physical needs are met. Before you move forward with the client to do an assessment or trauma work, making sure they've used the restroom or do they need to use the restroom. Do they have a cup of water to drink next to them? When was their last meal? We don't talk politics to a hungry man and we don't do trauma treatment with a hungry man. Trauma treatment takes a lot of food, so making sure you let people know to snack or eat before they come in if you're going to do a session of EMDR or trauma resiliency model. And especially adolescents, you do not want to start working with an adolescent who's hungry. They get hangry really fast. And parents often laugh when I'll say, please make sure your teenager son or whatever has eaten before they come in for the first session or any session because it takes energy to do this work. Human connection is also created. This is where you're developing healthy attachment. Tell me a little bit, in the emergency room, if I'm seeing somebody, I would say, tell me a little bit about what's happened in your life to bring you in. That's very different than full name, please, birth date, just launching. Of course, you got to get that information too, but really showing up and being personable and developing that trust. All right, self-soothing and emotional regulation skills help reduce somatic symptoms by regulating the sympathetic and parasympathetic nervous system. The sympathetic nervous system is that part of our nervous system, I like to call it get her done, where we are linear thinking, planning, executing our day, picking up the kids, dropping them off from school, running by the grocery store, picking up milk, getting gas in the car, getting to work on time, getting all the clients seen, rescheduling people. That's that sympathetic get her done. Then the and I also call that the gas pedal. You pressing the gas pedal. The parasympathetic nervous system is what I call the brakes. Other people call it brakes too, where you're putting the brakes on that get her done. You might be thinking about all the things you need to do, and then you think about, wow, my father or my son-in-law or somebody just went into hospice. He's been diagnosed with cancer. And you start thinking about all the things you need to do around that issue. And all of a sudden, you notice how activated and worried you are, and perhaps you pretzel up, take a deep breath, and say a prayer, if prayer is your thing, for the family and your son-in-law. So that parasympathetic, we can put the brakes on that get her done. And we get more done in life if we become more resilient and slow down. I always think of Richard Petty. He was talking about race car driving. He said something about, I believe, about keeping a foot on the gas and one on the brake. It's about using both the gas and the brake at the appropriate times. Like when you go around a curve, the centrifugal force, you may brake in the beginning of the curve, but when you hit a certain point in the curve, you got to give it gas to get traction to pull you out of that curve. So that's centrifugal force. And we're much like that, learning to use the gas as appropriate and build in the brakes as well. The problem with life right now is we spend most of our time right here on the gas pedal. And all the technology and work and news, and we're constantly listening and doing, and we never get to the brake. Doesn't it feel good when I stop talking? That's the brake. Our ears and brain, take a deep breath in the nose, slowly out through pursed lips. And there's the brake. So we need to build more brakes into our nervous system. And we're going to create a brake right now with bilateral stimulation or butterfly tapping. And I invite all the people at home to join us. I got to practice saying that. I feel like Mr. Rogers. Did you guys see the movie? I haven't yet. Yeah, I hear it's excellent. So, all right. So butterfly tapping is very simple. If you already have a client that's activated or emotional or upset, you can just have them cross their arms over their chest, like so, and begin alternately tapping like butterfly wings. And again, what we're doing is we're gently stimulating right and left brain, like rocking that brain like a baby. Now then, we're going to again start off with 4 extended exhales, so a deep breath in the nose. Slowly out through pursed lips, and if you're comfortable, close your eyes. If not, look down and soften your gaze. And a second deep breath in the nose, and that was a great yawn. 3 or 4 people yawned. That's the sympathetic brake. And a third when you're ready, deep breath in the nose, out through pursed lips. And a 4th, deep breath in the nose, out through pursed lips. That extended exhale stimulates the parasympathetic nervous system. In fact, everybody knows about, you've worked with or been around people who are blowers. They go, when they're frustrated or struggling. That's that parasympathetic nervous system. It resets itself naturally. All right, so if you'll stop that just a moment and open your eyes, need to take a break from that, because if you're working with a client, you can just launch this skill. But because some of you may not be activated right now, I want to activate you a little bit. I want you to bring up an issue that you can tap down. And I just forgot and just remembered, I can't cuss anymore, can I, if I'm doing this online? And imagine that. So I can't say what I was about to say. Maybe I'll do like that movie where she says sharp or shart for that word. I love that word, shart. So what we're going to do is I want you to experience tapping something down. I want you to feel yourself shift from sympathetic to parasympathetic, and I want you to feel and sense into how an emotion or issue can begin to resolve or even clarify or resolve. So think of something recently that's bugged you. Think of something recently that's bothered you. Think of something that got you into having an emotional rise. And throw your hand up when you have it. Anybody listen to the news? You got it. Right? All right. Anybody need more time? I can give you something. I can say, you have to stay 20 minutes late after class today because you did not pay attention. Do y'all remember that from school and how that felt? Yeah. All right. So what we're going to do, now that y'all have got that issue, and you're in your limbic brain, you got an emotional charge from it, we're going to cross our arms over our chest, and if you're comfortable, close your eyes. If not, look down at the floor and soften your gaze, and gently start tapping. Now, some of you, if this is overstimulating, you can tap with one finger. If that's overstimulating, you could do gentle squeezes. As long as it's alternate, it doesn't matter what you do to your upper arms. Well, it does, but... All right, and we're going to tap the shart out of it. I broke your trauma response. Sorry. Go back to the trauma response. I have to say that because I live by humor. All right, close your eyes, drop in, go back to that issue, and we're going to tap for 2 minutes, and I'll bring us out for 2 minutes. Your job is, if that issue scoots away, bring it back. Go back into the depth of it, the emotional charge of it, and just tap and watch what happens. And I'll bring us out in 2 minutes. And with a nice deep breath, when you're ready, begin to relax your arms down and open your eyes. Whee, now I got to teach again. All right, so what'd you notice? Anybody notice their problem clarified to something deeper or more important? Anybody experience that? That usually happens. Yeah, a couple of hands. I got a clarification. How many of you noticed a shift away from the emotion towards thinking about how you're going to work it out or how to work it out? How many hands? The majority. Okay. So what you did is you shifted from your limbic brain and the emotional response to your prefrontal cortex, where that linear executive function can begin to sort through and work it out. All right, other responses. How many people's problem got worse? Or you got more emotional? That's okay. Here, I want to, because we need to address that, because that will happen from time to time.
I realized that while what started it was sort of a minor annoyance, that it was tapping into something that I this is not the time or the place for me to try to be working on. So I kind of shifted into something else. But yeah, I noticed that.
Okay, so it went down what we call a channel into something else that really is disturbing or bothering. And isn't it great how the brain and body work together to point that out for you so that you now have an option to work on it, where before it may have been in the subconscious or deep, and now it's up. It's saying, hey, work on this. So that's a good thing. But if it's overactivating, you had the skill to shift away from it to something else. And if the client's eyes flew open and said, well, I was just like tapping down, taking my dog to the vet this afternoon because I'm worried that it's something serious, and then it channeled into or moved into the death of her father, because that's the similar fear, is that if my dog died, then it's taking me to memories of when my dad died. And if their eyes fly open or they say that's happened, say, if you're willing to breathe into that and us bring that down a level for you, or we can put that on a back burner and deal with it another time. So sometimes it will move to another one. It's kind of like how many of y'all do resourcing? You resource people to positive memories, and sometimes positive memories can go negative. In other words, a quick one, and what you do is you just invite them to go back to the positive memory and stay with that. Like, let's say, let's use a dog, for example, and I'm resourcing cuddling up with my dogs, and all of a sudden then I'm like, but I remember when my dog Phoenix died, and I feel really sad. So the purpose is we want to strengthen the positive memories. So if you would or could go back to snuggling with the dogs this morning, and I want you to describe to me when that started and what that was like. And so we just take them back to a positive resource. Clients will do lots of things we don't expect, right? We just have to be ready to work with whatever they bring to the table. And it's all okay. It's not that you did something wrong or they did something wrong. It's their nervous system coughing up, bringing up what needs to be addressed. We just have to put a marker there and address it another time, or if it's applicable for right now and everybody has time, then work with it now. All right, so bilateral stimulation. All right, we didn't stop to teach the pretzel. So typically this workshop, I have people turn and teach each other these skills. So we won't have time to do all 8. Let's wait and teach another one. Sound good? Because we're already behind. And that's both of those, most of you already do those 2 exercises. So let's move on. Dr. Dan, I'm holding this like I'm supposed to be talking into it. Dr. Dan Siegel and the 3-part brain. So there are multiple PDFs online. If you want a PDF for the 3-part brain, you can print that out. If you want to watch a video of Dr. Dan Siegel or someone else doing the 3-part brain, teaching it, you can. I'm going to teach you the way I learned it. You can also geek out on a glove that you can put on that makes your hand look like the 3-part brain. You can geek out on a lot of stuff in life. So it's amazing how much information's out there. But the PDF, I do hear the most people utilizing that. So there's multiple PDFs. You got to find the one you want. All right, so basically, when would you use this with a client? I use it with clients. It's a psychoeducational piece to teach about the human brain, to help them understand how their brain goes offline, how emotions can hijack them and take them over, and how emotional regulation can help get their brain back online. I teach it mostly to people that have severe anxiety, depression, and panic attacks, because they seem to me the most helpless to me at times, because they really do struggle with getting on with the business of their lives. All right, so I'm going to use my hand as a brain model. And so if when you were growing up or in school or any time in your life you've seen a model of the brain, it's basically, it looks like this. It's just kind of a round amorphous object. The top of the brain has 2 giant lobes, a right and a left hemisphere. So the cerebral cortex, which is what most of the brain that we see, when we look at a model of the brain is the cerebral cortex or the right and left hemisphere with a crack down the middle, right? And it's all squiggly. Looks like kind of like gray snakes all piled into something. So that is what we call our thinking brain. And I like to borrow from my grandmother, Felita Fleming, who said, Linda, put on your thinking cap. And I knew exactly what that meant. Quit running around and think about what you're doing. So I like to, in reverence to my grandmother, call this first part of the brain the thinking cap. So that thinking cap is what does all of our thinking. If you open up the thinking cap and you go to the midbrain or limbic brain is that part of the brain which I call our emotional brain or happy, glad, sad, mad part of the brain. And that part of the brain we function from a lot because we walk around the world going, I like that, I don't like that, that makes me happy, that makes me sad, that makes me mad, right? So we really are emotional beings. And how we feel about something when we think about it and we see it, it's going to trigger an emotion in that midbrain. Now in that midbrain, limbic brain close to it, is the amygdala. The amygdala is a part of the brain that we like to call our smoke detector or fire alarm. It senses danger. And when it senses danger, we have an emotion. We experience fear sometimes, and it sends a message up. If our brain thinking cap is still online, it may say run from what's happening or fight off what's happening, or that thinking brain may be so offline that it allows the body's blood pressure to collapse and a person just goes into a freeze and we have what's called a vagus nerve collapse. All right, so remember you've got a thinking cap, the midbrain is the emotional limbic brain, you've got the amygdala, the smoke detector fire alarm, then below that is the brain stem in the back of the brain, the hindbrain, which controls all of our automatic or autonomic functions such as breathing, respiration, digestion, hormonal functions, everything that's automatic. So let's put all this together. Let's say we're all sitting here, we got our thinking caps on, and I'm teaching, and all of a sudden out of that vent there, and this one, white smoke starts coming out and swirling down. And then let's say it turns to black smoke, and then we smell it, and it smells like an electrical. We know what that smells like, fire. How many of us are going to sit here and go, oh, well, I'm so interested in what Linda's got to share, I'm just going to ignore that? No, the amygdala is going to fire off. Oh my gosh, it could be a fire. We get fearful. Some of us will keep our thinking cap and will jump up and start for the doors to get out of here. And some people won't be able to move. They're in a freeze. And some of us will grab that person and start moving them to the door because we're still in our thinking cap, right? So will our digestion at that point stop? Possibly. Will our breath sometimes be held as we try not to breathe the smoke and we're holding our breath to get action to get out the door? Will some of us start to cry or scream? So we're going to have an emotional response out of that fear. So our brain is elegantly designed to help us survive that smoke coming and the fire that might be above us or coming from another room, right? So let's say long after that's over and we all survive it, and it really wasn't a fire, it was an electrical meltdown, but it didn't turn into a fire. We all survived it and everything gets cleared up and the windows are open. We come back in and we learn about trauma again. How well are you going to be able to pay attention? Some of you won't be able to pay attention at all because you're in a trauma response, so you're offline, right? Some of you will get right back into it and you'll actually use the examples of what happened to understand how the trauma works, right? Those are your ultimate thinking cap people. So the difference between those people is typically who's had the most trauma in their life. The most trauma stored in their brain and body will not be very resilient to get through the rest of the afternoon. In fact, they may have to say, I can't go back in that room at all. I've got to go home. Does that make sense? And that's many of our clients. We ask them all these personal questions. We do all these assessments, and then we expect them to have it together to go on to work or to go down the hall to a group room and do therapy? Yeah. And so we've got to teach emotional regulation skills like the pretzel and bilateral tapping and breathing techniques and all the other techniques we'll learn today to help them get back online to get through life after they attended a trauma training and got traumatized, right? Does that make sense? So again, thinking cap is where we do all of our thinking, and if that stays online, we're very resilient. Emotional regulation helps us stay in our thinking cap. You open up the brain, the limbic or emotional brain. This is where many of our clients live and function from. A friend of mine who's a psychologist said, I grew up with an alcoholic father and a passive mother. When I wake up as an adult in the morning, I am a bunny rabbit and the world is full of wolves. Does that make sense? So she's still living that trauma of a father who is a wolf and a mom who was a lamb, and she took on the lamb role. And what kind of husband do you think she married? Oh, how'd y'all know that? And you would think if we had a wolf father, why wouldn't we marry a wolf husband? Because the brain and body interprets that as love. We can become so miswired in our brain and body as a child that we interpret how Father treats us as love and grow up and marry someone and be wired for love that's hurtful. Now, I'm sorry I didn't have that in a slide for y'all today because that's not how my brain works. I have to give it to you as I'm teaching. So does that make sense? If Bessel van der Kolk, if you really want to be made nauseous, read in his book about what the experiments they did on dogs. But if you're a dog lover, skip that chapter. I had to pull my car over on 40 and cry when I was listening to that. I was going down to teach a workshop in Raleigh. It was so traumatizing for me because I am a dog whisperer. Dogs are my heart. I was also born in the Chinese year of the dog. We won't go into that. All right, so if y'all got the understanding of the brain, 3 parts of the brain, how to share that with clients, it's on your handout as well. Get the PDF, watch the YouTube videos, use the YouTube videos in your group settings where you're doing group therapy, and then discuss it and apply it. How does that show up in your life? I've got 2 or 3 skills that I can teach you to help your nervous system survive your active trauma response of fight or flight. They will love you for it. All right. Questions? I saw a hand go up at some point. Yes, sorry. Let me give you this if you would so that we can record you for posterity.
Oh, okay. So I was just curious if you had any sources that we could look into regarding how long, in research, how long it takes to, I guess, re-regulate hijacked hypothalamus and amygdala.
2 minutes.
Really? Okay.
Yeah, with the posture and breath work. Yeah. 2 minutes being, now, people are different. I'm not going to say it's the gospel, but have the client, how I would teach this with the client, you can give them research, but how many clients are interested in research? They just want what works, and they want you to teach them what works. So I'd say dig for the research. I've seen it, I just don't remember where. And it may be in some of the Peter Levine or Bessel's or some of them's work. But so what I want to say is start with 2 minutes and then invite them the next time you're meeting with them. Because if you know me and you've had therapy by me or I've supervised you, I start every session with the pretzel. What the pretzel does, or the hookup, is, and it's also, it could be a seated, S-E-A-T-E-D, seated eagle, if you do hatha yoga postures. I start every session with the pretzel because it resets us neurologically and gets us in the room. And it preps the nervous system to be in the here and now to work on issues. So it's a part of therapy because it builds resiliency and it teaches a client how to drop in and work with their brain and their body. So every session, anybody in here I've supervised that pretzel? Oh yeah, a couple of folks. Y'all, you can tell them, yep, Linda, she does that pretzel. And you really think I'm doing it for you? I'm doing it for me. Because if you think about, I see one person every hour for 8 to 10 hours a day. That's 8 to 10 pretzels a day. That's cheating. I couldn't carry that rigorous caseload or of people if I didn't pretzel up. Because that means I'm taking on and listening to that much trauma. Because I treat solely trauma and addiction, of course anxiety and everything else, but it all comes from trauma. So is that helpful? The 3-part brain, you've got that in front of you. Normally we'd divide up and practice that, but y'all have got it. All right, so the role of emotional regulation and self-soothing for activated, stressed, or traumatized brain. Let's pull all this together, the 3-part brain, and understand. When the frontal lobes or the cerebral cortex are engaged and functioning, the thinking part of the brain, functioning to make decisions, the body and the brain are centered and grounded. So when the thinking cap is working, when we get into our thinking part of the brain, we can settle in and be centered and grounded, and we can make decisions about our lives, right? That's the goal. We want to get people out of the limbic emotional brain and over dramatic and responding to being in a calm, grounded thinking place. Peter Levine is really, is it Peter? No, Dan Siegel, Dr. Dan Siegel, is really into talking about the prefrontal cortex, the right prefrontal cortex. We've seen, I don't know how they say it, I'm assuming MRI or something, maybe SPECT imaging, I don't know. When a person is meditating and they're in a deep meditation, the right prefrontal cortex lights up. And that part of the brain is the part of the brain where our values are stored, what's important to us. So when we're in that deep meditation, we're lighting up that right prefrontal cortex. So that's where, if you want to really geek out and dig deep, Dan Siegel, yes?
There's also very new evidence that's showing that...
Hold on, this is good information.
I just got this.
Yes, please.
Got this from Dr. Deborah Davis at UGA in a training just a couple weeks ago.
University of Georgia?
Mm-hmm.
Okay.
Mm-hmm. That 20 minutes to 2 hours and 45 minutes, so somewhere in that range of meditation a day will lead a withered hippocampus to regenerate and regrow.
Excellent. And it shrinks the amygdala too. I believe that there's research out showing that. So not only the, oh gosh, talk about a brain. Not only the amygdala, but the hippocampus has the ability to regenerate or to heal. We can heal our brains without big pharma, which just suppresses symptoms. All right. When the midbrain or limbic brain or emotional part of the brain becomes predominant, in other words, when we're hijacked and we're functioning from there, a person may be less resilient, they may be impulsive, angry, resistant, or in a protective stance. Y'all know what that looks like, right? You want me to what? What'd you say? The person may not be able to fully engage learning or benefiting fully from mental health treatment. So it behooves us to teach these regulation skills on a regular basis and practice them so that our mental health treatment and our therapies are more helpful. A very activated patient may become assaultive. So we actually may be triggering people into assault mode if we're not utilizing emotional regulation skills. So emotional regulation and self-soothing bring balance, centering, and grounding into the moment to support full integration of body and mind, leading to more conscious decision-making and learning. In addiction work, we talk about psychoed that it's important to keep teaching, keep them understanding and learning concepts. We have to repeat those concepts. Why do we have to keep repeating concepts about addiction and recovery? Because in early recovery, what's going on in the brain? Pause. Post-acute withdrawal syndrome. What's paused? Post-acute withdrawal syndrome, they are having trouble with linear thinking. They're physically sometimes unable to bring balance to their body. They have cravings. They're very emotional. So post-acute withdrawal syndrome, look that up. And this, I believe, can help with that. Do I have research to prove it? Not yet. You know that what? I just got to say this out loud, so it's just a disclaimer. Before things become theory and proved, they have to be done and studied, right? That's what we're doing. So if anybody is of a research mind, you can do a study of N of 1 or whatever and get on it. Reduction of somatic symptoms caused by stress, trauma, and adverse child experiences will lead to the client being able to stabilize, heal, and recovery. So we want to reduce and mitigate the symptoms of fight, flight, freeze, and fawning. You guys are getting this, right? You guys are living this every day. We're just putting the pieces of the puzzle together. That's why you can attend this workshop 3 or 4 times and hear something that you're new and ready for. The following are 3 skills that can create a feeling of being grounded or calm for an individual experiencing a current or past traumatic event. A, running away. B, crossing midline with their extremities, arms and legs, such as practicing the pretzel for 2 full minutes with 4 extended exhales. C, bilateral stimulation by tapping opposite sides of the arms or legs, often called butterfly tapping. And D, walking calmly with the client, encouraging them to feel the strength in their legs and how their legs can carry them to safety. Or E, all of the above excluding number 1. E, yes. All right. So there's Dan Siegel and his 3-part brain, if you guys want to look that up. He's really into talking about an emotional state, either negative or positive, becomes a trait. It becomes a trait of our thoughts and our behavior. So the more we meditate, we're creating a peaceful trait. The more we blame and hate people, the more we will be activated, and the more blaming and hate we'll do, and will also bring that back on us. So an emotional state, either negative or positive, becomes a trait. Emotional regulation leads to insight and conscious decision making. Insight and conscious decision making. Isn't that where we want to be every day? It was really interesting how Spirit works with me. I just want to fess up and be transparent, use some immediacy and transparency. 2 of you in this room right now look like people out of my past who have traumatized me. And I'm just really aware of that right now, and how as I look at you, I am saying this person is a counselor. This is not the person that hurt me. Isn't that interesting? How even people, we can be triggered by, you're not that person, but you look enough alike a person who hurt me that I'm having a traumatic and a trauma responsive, that gut. But that's okay, because now that I'm around you and I'm saying that in my head, this person is not who hurt me, this is a person who is a counselor, it dissipated. And so I just gave you an example of resiliency and how I can use a positive thought and a thought stop and an interruption to say what reality is. Now, if I kept saying, that person reminds me of so-and-so, that person reminds me of so-and-so, I can't believe she or he looks like so-and-so. Do you hear the difference? An emotional state, which got created or triggered by 2 of you looking like people that have hurt me, either negative or positive, becomes a trait. So I shifted from a somatic response with a thought to interrupt my somatic. And that, I don't even know what that technique would be called. Thought stopping, maybe? Shifting, pendulating over to a positive. But I just wanted to share that with you, that I am actively using these skills in this room right now, because I'm a human being with a body that grew up in a violent family, in a violent world, and it's still violent. All right, so understanding trauma. How much do I want to? I'm trying to sort out about what I want you guys to watch or not watch. And we're already behind. I'm going to save this for after lunch and see how far we can get, because I want to get some more skills. This is a video, if you just Google it on YouTube or search on YouTube, Understanding Trauma, it will pop up. And I show this at Mission a lot because it's really Western medicine. It connects. It's like integrative medicine. It's a physical therapist who does this short presentation on all the systems of the body and how each system is affected by trauma. So it's very good. And in fact, when I showed this at Mission, one of the physicians said, how fast can we roll this out, these emotional regulation, because he got it. For the first time, this physician connected what is psychological is biological, and what's biological is psychological. And I was pretty excited to see his epiphany and excitement, because
Mace actually refers to that as your biology becomes your biography becomes your biology.
Say that again?
Your biography becomes your biology.
Yeah, your biography becomes your biology. I like that. Carolyn Miss. Yeah.
It's
MYSS, yeah. Thanks for sharing that. The words like that and phrases really capture it, don't they? They direct our mind towards a deeper truth or reality. So what we would have just watched is trauma or negative life events affect all the systems of the body and may lead to chronic health problems, chronic pain, depression and anxiety, hopelessness, chronic fatigue, and many, many other physical and mental problems such as diabetes, high blood pressure, bowel disturbances, you name it. So that was just kind of captures what that's about, but not as much detail. So we want to look at what is trauma in childhood. We're going to move towards children a little bit. And some of you might say, well, I don't need to know that because I only work with adults. Well, guess what? Your adult in your office used to be a child. So it's important to also know where that adult has come from. We know that prolonged exposure to repetitive events, repetitive or severe events such as child abuse is likely to cause the most severe and lasting effects because it so interrupts a child's development. So when you think about Erickson's 8 stages, you know, trust versus mistrust, initiative versus guilt, and all those developmental stages, think about those being interrupted. And what happens is sitting in front of you in your office. That you're wondering why they can't think through their problems. We're wondering why they don't have the confidence or the motivation to apply for food stamps or to get their child put in daycare or even try to get their child back and comply with DSS's treatment plan. We are looking at someone who is struggling as a child to have attention in the classroom, and they never did well in school, and here's somebody telling them what they've got to do to get their kids back. Do you see the parallel? They can't be attentive right now because their kids have been removed and they're wondering if they'll ever get them back. Which part of the brain is she functioning from, or him? Are they in their thinking cap? No, they're in the limbic. And how's that affecting their body right now? Pretty negative. Even if they've had breakfast, they're not digesting it. Even if they're taking their high blood pressure medication, it still may be high, and we expect them to follow this treatment plan that we've put together with them and DSS's plan, right? And carry out a job and deal with a difficult spouse. No wonder they don't get their kids back. But we're trauma informed and we'll chunk that for them and we'll help them work with that. We'll make that call to their DSS worker and navigate. She doesn't even know daycares to even begin to start looking for daycare for her children, much less how to pay for it. You kind of hear that? We are the facilitators of that. Traumatization can also occur from neglect. We only think about abuse, but what about the child whose mother or father's passed out and they're pushing a chair up to the edge of the kitchen counter to climb up there to get Cheerios or Fruit Loops? But they're not big enough to pour the gallon of milk, so they accidentally spill it, and a parent wakes up and beats them for that. That's neglect with abuse. Traumatization can occur from neglect, which is the absence of essential physical or emotional care, soothing and restorative experiences from significant others, particularly in children. So not only is it abuse, it's neglect, it's prolonged exposure, and there's keywords that you can search. It's called ambient violence. When violence becomes ambient, when it's part of your everyday life as a child. And that's what this video is about. We'll pick up that later this afternoon, possibly. Trauma, brain, and relationships, helping children heal. It's about 25 minutes long. So types of trauma, both in children and adults: cumulative, daily child abuse or neglect, domestic violence, unsafe food or water, war in one's country, trapped in a job that's abusive or stressful, ambient violence, which I just talked about. So that's cumulative. It's every day. Then a single one-time event. This is the easiest to treat and responds the quickest, in my opinion and in my experience, such as a car accident, a hurricane, or a death of a family member or friend. It's not that this is any not worse than others. Single events are just stored in the brain and body differently. And we know and we see that. Complex or layered trauma. A child has trauma, then goes off to war and has trauma, then or a child that has sexual abuse as a child, then marries an abuser. Layered trauma is often more difficult to treat, but can be treated and will respond well to our emotional regulation skills that we're learning today. All right, let's go ahead and do a breathing technique. I'm going to engage a breathing technique to wake us up. I see some of y'all getting sleepy. Let's do Bastrika to wake folks up. Bastrika. How many of y'all, anybody know Bastrika? It's a great, you can get on YouTube, it's there, but it's so simple. So stand up, get a little space between you and your neighbor. We're just going to go up with our arms like this. If you do 3 rounds of this, 20 of them, 3 rounds in the morning in the fresh morning air, it will put shame to a cup of coffee. So we're going to start with our fists like this, and I'm going to demonstrate for you. First, it's going to really heat us up, so we'll probably have to open that door. So how it works, don't do it yet, just watch. We're going to go strongly, I can't even talk, up, like on the inhale going up, and it's really forceful. It's and down. And we're going to do 20 of those. If you get dizzy or you're not comfortable with that, stop. Because we should be outdoor. In fact, let's go ahead and open the door. Let some air in. Called Bastrika, B-A-S-T-R-I-K-A. It's a yogic type of breathing. It's a wake up. And this actually will increase your prana. In Ayurvedic science, 80% of our energy comes from breath work. So the more you do breath work in the morning, the more energy you'll have all day. All right, so arms up and breathe in and exhale. We'll go faster. And relax. Woo! All right. Anybody sleepy now? All right. So this is kind of the opposite of emotional regulation, but we need it. All right. So taking a deep breath and relaxing. Just dropping in. Another deep breath. Usually I get the most comment from people who have low blood pressure. It tends to make you a little woozy. All right, and up arms again. If you're comfortable, we'll do a second round and begin. And relax. Woo! All right. Cup of coffee. Oh, got it going on now. Everybody awake? All right, we got one more round if you're up to it. You don't have to do it. There's no force. This is all. This is complimentary before lunch. It helps with the digestion too. So a couple of nice deep breaths, really just sensing in, dropping to your body. Notice how you feel different now than when you started. Letting your shoulders drop. Just dropping in, just being a friend to the body for a minute. Moving your shoulders or neck, stretching out a little bit. Ready for round 3? All right, arms up. If you're comfortable, and begin. And relax. All right, have a seat. And enjoy. It's great to be alive.
So this is activate.
Yes, this activates, super activates, and then lets us calm and drop in. So it's like pushing the system a little bit so it can feel that it's activated, and then it calms and drops in.
Is it helpful for someone who's dysregulated?
Not while they're dysregulated. You would want to teach it for energy when they're not dysregulated. Because one of the problems is our clients they lose their prana, their bodily energy, because they're staying activated all the time. So when they wake up in the morning, if they were to do Bhastrika or another breathing exercise that's invigorating, it will reset their nervous system by stimulating it, and then it returns to homeostasis. So that's why we physically exercise. You go for a run, does your pulse stay way up there? No, it drops back down. So actually exercise can benefit emotional regulation by stimulating all systems of the body so that the body can then practice returning to homeostasis, if that makes sense to you. So, and you've heard of a runner's high. A runner's high comes from endorphins and neurotransmitters, and that will make a person more resilient and more happy. All right.
Can you please spell Bhastrika?
Bhastrika, B-A-S-T-R-I-K-A, I believe. Bhastrika, just like it sounds. If you go into any yogic type breathing, there's energizing breathing, and then there's, which is your sympathetic again, your exercise, and then parasympathetic, relaxing, getting ready to meditate or do mindfulness. All right, so what is violent interpersonal trauma? We want to address that. Interpersonal violence, such as sexual assault, abuse by a caregiver, domestic violence, tends to be more traumatic than natural disasters or other trauma because it is more disruptive to our fundamental sense of trust and attachment and safety, and is typically experienced as intentional rather than an accident of nature. So violent interpersonal trauma really creates a lot of stored trauma because it typically is coming from someone who we're connected to, that we have had trust with or support or love. So really it's important to recognize that if you have somebody that came up here from Hurricane Katrina and that's the only trauma they've ever experienced, it's going to treat very quickly and differently typically than someone who has developmental trauma throughout a lifetime, if that makes sense. So we're going to learn heart hug. This is our third skill. This is done quite often on cardiac units after a cardiac surgery or after a cardiac event. You're going to take your right hand and put under your left arm, not up in the armpit but below it, left hand on the mid-upper arm, and a gentle downward pressure and or squeeze. And hold that posture. The gentle pressure on the ventral vagal nerve stimulates the parasympathetic nervous system, which is the gas or the brake. The brake, yeah, it's putting the brakes on the sympathetic. So it's bringing about a feeling of safety, connection with self, and containment. Self-containment. This is where Peter Levine says, people with trauma have a hole in their container, their hemorrhaging energy, and this reassures and keeps us connected with ourselves. In DBT, it's called turtling. They have them wrap themselves up in turtle. On Copestone unit, on the children's unit, we actually have little turtle rugs where they go get on a rug and they turtle up. So breathe in the nose and out through pursed lips while holding this. And a second. And if you counted slowly up to 120, would reset that sympathetic nervous system to rest and relax. Another great words that we call the parasympathetic nervous system is rest and digest. So this puts us in rest and digest.
Would that kind of be like weighted blankets?
Yes, it would have a weighted blanket type response. Yes, so I highly recommend weighted blankets. I've got one at Tuesday mornings in Asheville. They did have weighted vests. If anybody's interested.
This is actually a question of clarification. As I've been looking at Porges' work, he includes the dorsal vagal in the parasympathetic, which is not how I ever thought about the parasympathetic before, and it's been a whole new reconfiguration for me.
Which is the collapse associated with the vagal collapse.
Yes.
Which is what we see in soldiers. Sometimes will lose control of their bowels and defecate before going into battle because it scares the shart out of them. All right, and they're thinking during Cro-Magnon times when we had a pterodactyl going after us or a bear or something, that may have been how we survived, that if we pooped and we had a bowel release, that distracted the bear or stunk and they didn't want to eat or grab onto somebody that had soiled themselves. So we know that vagal collapse or dorsal vagal nerve is responsible for butterflies in our stomach, warning us that if we're about to make a speech before 500 people, that they could all judge us at the same time. So run. People ask me, Linda, do you ever get nervous before a presentation? And not typically because I've been doing it so many years, but one time I did get nervous and I checked in with myself. I was presenting at a fairly large conference towards Raleigh. And I woke up in the middle of the night with that activation, that nervousness, like, oh, I've got to speak to all these people. It was the first time I'd ever done that conference, and I was responsible for teaching 2 full days. I was the key headline person, and it hit me that I didn't know these people, and I sat up and meditated and prayed about it, and I tapped it down, and you know what came to my head? I love this, prayer works. They're all substance abuse counselors, and who do you think loves you more? People who aren't substance abuse counselors or a room full of substance abuse counselors? And I went, oh my God, they're my people. Isn't that great? So prayer and meditation was a complete reframe for that trauma, which I was like, I've never been to this conference before. What if something goes wrong? What if they don't like me? What if I stumble? What if I accidentally cuss? And they go, oh my God, she cusses. Or, you know, in substance abuse counseling, that was never going to happen. But, I mean, you know, I didn't realize I had all this in my head. And so as I prayed and meditated, then I went, oh, my gosh. And, you know, that's my favorite conference now. I go there every year. And we're all hugging and kissing each other's cheeks, going, how you doing? You know. And I'll tell you, quick, bad segue, bad part of that is after the conference this year, one of the women who's about my age had a grandson, and she had shared about him being in active addiction. He came into her condo and murdered her the week after the conference this year. I mean, it devastated us all. So just when you think trauma's out there somewhere else, we lost one of our own to an active addiction from her grandson who crazed on meth. And I'm sure he was probably came to rob her or ask her for money, and when she wouldn't give it to him, he lost his mind and murdered her. So sad thing, and I share that because this is life on life's terms. We aren't free from trauma just because we're substance abuse counselors or we're counselors. It happens around us on a daily basis. So I didn't know what to do with that. And in fact, I pulled up my cell phone and there's a picture of her and us together. And I just sat and held it in my hand and cried and prayed for both of them, for her grandson and her, because he'll probably do life in prison for that, and she would never have wanted that. She would have wanted him to get treatment. So that's trauma. That's personal trauma. All right, so now we're all going to tap that down, tap the shard out of it. All right. We're going to take a break in about 5 minutes because many of you will go to town and eat, and we want to try to beat the lunch crew, if that sounds good. So what childhood developmental trauma may cause what appears to be oppositional or defiant type behaviors. B, poor attachment with caregivers. C, lack of social skills leading to lack of trust. Or D, poor attention span leading to learning problems. Or E, all of the above. All right. Don't y'all love my test questions? It reinforces knowledge instead of worrying you about the right answer. Trauma and they're not all that easy though. Trauma and traumatic events include personal and private experience as well as public experiences. That I just described would be called a public experience, where a whole group of people experience a deep trauma. So examples of personal and private: sexual assault, sexual abuse, domestic violence. And I'm adding this piece in, it's really, really important, witnessing domestic violence, because many children and people witness domestic violence, especially as a child. In North Carolina, law prohibits the abuse of a child or the child's caregiver. So the child's caregiver being the person caring for the child. So report it to DSS if you suspect caregiver abuse. This is a law in North Carolina. It's about in all the states now, but people forget that. Even if that, let's say you got parents in the household or partners or whatever you would call it, if one is abusing the other and they are caregivers of that child, that is the same as abuse to that child, because the caregiver cannot give adequate care for the child if they're being abused. Plus the child is seeing it, hearing it, and experiencing it. And we know that children born into a household who experience childhood trauma and domestic violence are more likely to grow up and become what? Abusers themselves, yes, and thus that law. And even if you say, well, DSS has never done anything about it in the past, it doesn't matter. You are the gatekeeper to making sure that you've notified the proper authorities to get that child the care or support they need and get them to safety. So examples of other public trauma: natural disasters, war, or like I described my friend who was killed by her grandson, community violence. Yes?
Hey, we have a question from online asking what conference were you referring to? The conference you told the story about just now?
Oh, do I have to tell?
Someone asked.
Okay, yes, I will tell you. It's the one that I go to everywhere that you referred me to. What's it called? It's an acronym, NCARF. North Carolina Conference on Addictions and Alcohol, something, something. So if you Google NCARF, yeah. And I'm not going to share her name because that's too private. But yeah, it was the NCARF conference. NCARF? NCAARF. It's an addictions conference, and it has been in the past. I can't believe we've got somebody watching. Hi. Welcome. It was originally for residential treatment programs to come together to share and learn, and now it's just an addictions conference, and it's quite good. Yeah. I'm taking this spring one off, but I'll probably be back in the fall, but I'm actually going to go study abroad. So North Carolina law prohibits the abuse or neglect of a child or a child's caregiver, and thus any North Carolina citizen or professional must report it immediately to the authorities or the County Department of Social Services. True or false? True. So I want to point out, any North Carolina citizen, it applies because we're all citizens, or professional must report. So it's not a law just about professionals, about you. It's for any North Carolina citizen. All right, so it's 1:45. I'm going to take a break. I want to give you one thing to chew on at lunch. Remember this key phrase, that trauma is stored because it's too much, too fast, and too quick, and can't be processed. The event or emotions can't be processed. Think about that. Too much, too fast, too quick. If it's slow and you can do something about it, you don't get as much or any trauma stored. But it's too much, too fast, too quick, and the nervous system hangs onto it and reminds you, if smoke comes out of those vents, run. If it doesn't come out, you're safe. So it pulls on past memories as well as your own knowledge base right now. Too much, too fast, too quick. See you back here as close to 1 as possible. Thanks for your participation this morning. And I'm going to be going to lunch. If 2 or 3 people want to ride with me to lunch and discuss trauma, we can do that. Or addiction. Yeah, I'm going, and I'll be